We're trying to educate folks and say this is helping people. Most folks have a loved one that could have benefited or could benefit from this therapy.
In 2012, Massachusetts voters approved a ballot question legalizing marijuana, with Bridgewater residents in the majority.
Going about setting up one of these, one of the most important things to do is first find a community that is going to be willing to work with you and is progressive and understands the importance of this product and this therapy to people in need.
After exploring options for a medical marijuana facility in Bridgewater, the team behind Theory Wellness Incorporated found its home on Elm Street.
We will be the first company in Massachusetts to open a medical cannabis business that's all brand new construction, which we believe is the best way to go about this process.
This will be the corporation's second location and includes a state-of-the-art facility with a climate-controlled cultivation room.
Setting up one of these companies in Massachusetts is certainly complicated. In Massachusetts, you have to be a vertically integrated medical marijuana company, meaning you have to cultivate all of your own medicine as well as set up the retail side of things too to actually serve patients.
And only patients. Retail does not mean open to the public.
Unless you're a patient or caregiver, you're not allowed to come inside the facility.
Once a person registers as a patient through the Department of Health, they are allowed in, but security here is tight.
They take their card out and place this buzzer, hold their card up to this camera, and then our receptionist inside would verify the card and then allow access by unlocking the door, and then they could go inside the kind of staging area.
There, they'll present several forms of ID and their unique patient number.
It's kind of an additional layer of redundancy where unless you have that valid number on that valid card, you wouldn't be allowed inside of our facility. So it's more than just looking at the two IDs, it's also verifying with the electronic system with the state to make sure they're a valid patient.
After that process has taken place, the patient is allowed into the main space, which operates like a pharmacy,
where we'll have the retail staff and patient treatment advisors perform transactions and educate folks on the different options we'll have.
The state has given their final approval and cultivation has begun. Plants will reach their maturity in about 3 months, and the team plans to have about a dozen different products to start.
We'll be starting with about 8 different varieties of cannabis. Each one has its own unique effect. So some are better for folks that are undergoing chemotherapy, some are better for folks that are looking for relief just in the nighttime versus the daytime. On each individual product, there's labeling that includes the cannabinoid profile of the product, which is the different chemicals that are in it. There also are warnings about how it has intoxication effects, that it's not been necessarily approved by the FDA.
Other side effects include nausea, dizziness, and lung problems.
We're looking and recommending products for patients that are more medical and less, that don't necessarily necessitate smoking, because most physicians would not recommend smoking anything.
Since its legalization, studies are beginning to show medical marijuana is helping people decrease their opioid use.
We see folks substituting a lot of opiates for medical marijuana, which is a tremendous positive impact on the community that's just starting to come out in some clinical studies. We had an instance in New Hampshire where a patient came in tears because they had MS and they were on a lot of different pills. They weren't able to ever kind of be mobile at all, and they started using cannabis, and the next day they played basketball. He played basketball with his 5-year-old son for the first time in his life, and it was an amazing moment. So we look forward to helping people feel better.